Hello, I'm Dr. Maurie Markman from City of Hope, and I'm going to be briefly discussing a very interesting paper which recently appeared in the Journal of Clinical Oncology entitled Costs of Cancer Prevention, Physical and Psychosocial Sequelae of Risk-Reducing Total Gastrectomy. Clearly, the oncology community is very familiar with risk-reducing surgery. Certainly the experience in with individual, the BRCA mutations for breast cancer, ovarian cancer, the benefits of the surgery are very well documented. We also have that experience in individuals who have a familial adenomatous polyposis and the potential benefits in reducing the risk of colon cancer with colectomy. This is a different surgery, though. Here we're talking about total gastrectomy, and obviously for different germline mutations. This was the CDH1 variant. A total of 126 individuals who underwent such surgery from a period of October 2017 to December 2021. It was very interesting that the postoperative major morbidity, as one would have hoped and expected, was quite low in this population, 5.6%. However, if one looks at the longer-term effects, almost all of the patients in this analysis lost weight. At 2 years, 94% of the individuals had at least one chronic condition. A quarter of the patients had a change in occupation. There were a number of other social factors noted. And very importantly, the quality of life for the individuals went down after surgery, but very importantly, according to this analysis, that between 6 and 12 months, the overall quality of life returned to what was described as baseline. I think the most important part of this analysis is, in fact, the information that is gathered, both the short-term and long-term outcomes, and the fact that this is information that needs to be shared with prospective patients who are considering the surgery. Now, the risk of the cancer is obviously a critically important point. And here, obviously, the knowledge is that a very large percentage of these individuals with these germline variants are at risk of developing this cancer, gastric cancer, during their lifetime. But what about the negative effects? What about the short-term and the long-term effects? This has got to be included in the discussion with the patients. And the information as collected in this particular analysis and other analyses that hopefully be done in the future are vitally important as part of this conversation. Again, I would encourage those of you who are involved in this area, thinking about this area, patients you need to counsel in this area. This is an important paper and an important discussion. I thank you for your attention.